care provided by millions of unpaid family caregivers across the U.S. is valued at a staggering estimated $600 billion annually, according to the latest report in the AARP's Valuing the Invaluable series. So today, Josh Askvig, State Director of AARP North Dakota, is here to tell us what this report says about the invaluable contributions made by North Dakota's caregivers. So good morning, Josh.
Good morning. It's good to be with you, and thanks for the opportunity to talk about the significant cost of caregiving, that opportunity, the financial health and well-being costs, and family caregivers bear it all.
So what is the situation for North Dakota's caregivers?
Yeah, I think the report shows that family caregivers truly are the backbone of our long-term care system in this country and in North Dakota. And when you look at the unpaid care provided by the 62,000 caregivers in North Dakota, it's valued at $1 billion alone. And while the number of caregivers in North Dakota actually dropped a little bit from the past report, the hours of caregiving rose from 57 to 58 million, and that the unpaid contributions, or the amount we would have to pay if these folks weren't family members, trusted friends, or others doing this care, it actually increased by 20 million since the last report in 2019. And so I think to sum it up, caregivers are providing more care. There's fewer of them, and it's a substantially higher total economic value since the last time we talked about this.
Yeah, absolutely. So what were some of the big takeaways in this report?
Yeah, I think there's really three of them. The first of which is we're seeing a lot of the sandwich generation caregiving driven by the aging population in the U.S. and the continuing trend of delaying first birth. So the age range of sandwich caregivers now includes Gen Z and millennials. It also really makes work disruptions and work supports key issues. Those younger caregivers are still in their prime working ages. Additionally, most family caregivers work outside the home. 61% of family caregivers are working either full-time or part-time. And again, those work disruptions can include leaving a job, cutting back hours, or foregoing promotions to make sure they're caring for their loved ones to keep them safe and independent. And then the last piece is something I know you guys have reported on extensively, and we're hearing a lot in the legislative session, is the shortage of direct care workers is having an impact on family caregivers. The shortage of direct caregivers is causing higher hours and higher intensity of caregiving. We especially saw this exacerbated in the pandemic. And that in 2022, Medicaid state administrators were surveyed, and in all 50 states, they're experiencing some shortage of direct care workers that's putting additional pressure, not just on family caregivers, but families. And it's an issue for not only families, but the state and all.
Yeah, absolutely. It's definitely been a difficult time since the pandemic and onward with the shortage in caregivers. So what push is happening legislatively in North Dakota to address the challenges faced by these 62,000 North Dakotans who are clearly doing some heavy lifting for the people they love?
Yeah, absolutely. AARP North Dakota has been very focused this session on ensuring funding for accessible and affordable housing, expanding access to safe and affordable long-term care services, and then senior nutrition funding enhancements and enhancements to the Aging and Disability Resource Link. Specifically, we've supported efforts in the North Dakota Department of Human Services budget to provide additional staff support, to provide that community education, state funding for in-home support services such as adult foster care and family home care, as well as those nutrition services or family home delivered meals, home delivered meals or congregate meal settings that are often that first line of ensuring folks can stay independent. We've also looked at expanding the North Dakota Homestead Property Tax Credit, or providing supports that allow folks to be able to buy down property taxes if they need that support for adults over age 65, which allows them to stay in their home longer. And then a number of efforts, including a study around paid family leave in North Dakota and looking at those working caregivers.
Yeah, absolutely. All sound very, very important. So thank you, Josh, for running that down. Where can people get more information about this report or read it in full?
Yeah, you can find the report at aarp.org/valuing.
All right, wonderful. Thank you so much once again, Josh, for joining us and telling us all about the very important topics there.
Good to be with you.
All right, we'll have lots more on North Dakota Today. You'll want to stick around after the break.